Welcome to this Adult Education Senior University session, The Empowered Caregiver Supporting Independence. Our presenter today is Linda Curley. Linda is a Purdue Extension educator and Alzheimer's Association community educator. Thank you so much for joining us today, Linda.
My pleasure. So I wanted to welcome you to Supporting Independence. It is part of our Empowered Caregiver series. There's 5 different sessions within the series. They are hosting all of them here, so hopefully if you haven't signed up for those already, they may be something that you might consider for the future. My name is Linda Curley, as was mentioned earlier, and while I work with Purdue University Extension, I do partner with the Alzheimer's Association because I'm not sure if you're aware of the fact that Lake County, Indiana, where we are today, it has the highest incidence of dementia and Alzheimer's. And so when I do a needs assessment of the community and realize the importance of bringing information to the community in terms of Alzheimer's and dementia, this really ticks that box simply because of the fact that there are so many affected in this community, both individuals who have been diagnosed and those that are caring for them. And that brings me to this question, and those of you who are at home, if you'd like to pop information in the chat box, you're more than welcome to. What brings you here today? What brings you to this session today?
We have someone who's caring for her mom who's moved in with her who has Alzheimer's disease. Someone here is for observation as she's giving her first class on this next month. Someone who is a former caregiver for her mom, but her sister's now showing symptoms. Another person says that her mother is end-stage dementia and she'd like ideas for enhancing her sense of independence. And another person, my friend's parents had Alzheimer's.
Okay, thank you for all of those comments. And do know that we have many stages, throughout the course of diagnosis, even those very early stages where you're really just kind of trying to figure out what's going on. So know that all of the information that we're going to be providing to you today, you'll kind of have to think about the progression of dementia and Alzheimer's and see kind of where you fit in terms of the things that you can do as you try to support the independence of the individual that you're caring for. And as you move through that journey. So today, if we could, I'd like you to keep your questions until the end of the presentation. But what you'll notice during the course of the presentation today is there's a lot of times where I will ask you a question where you either choose an answer and give me some feedback, or in fact, you may just kind of sit tight and say, I'm not really sure. So you'll be able to notice those because the slide will dictate that. So we'll take time to do that. Certainly, those of you that are at home, you can certainly put your answer in the chat box, and Amanda will help me through as she picks up those answers. Okay, so again, supporting independence is the topic that we are focused on today. Last time I was here, we did building foundations for caregiving, and you can see there's 3 more topics that sit underneath supporting independence. All of these are topics that we're going to be delivering here again in the future months. So please connect with Cure and with Amanda so that you know when these dates are, if these are of interest to you. Let's look at some of our learning objectives today. We are going to explain the changes in independence that happens with people living with Alzheimer's or dementia throughout the course of their diagnosis. We'll also describe the 4 steps for helping with personal care activities. Today we'll be focused on things like showering or bathing, things like eating, things like just caring for yourself in your everyday life. We'll list some tips to help make activities a little bit more meaningful for both you and the person you're caring for. And then we'll identify ways to know what's the right amount of support to give an individual and at the right time. Sometimes things go well one day, but they don't go so well the next day. So we'll talk about how we move through that. We'll also describe how dementia affects safety in the home, and we'll be focused on a couple of areas that we really want you to have information about in case there is something going on in your household that you'd like to be aware of. So most people living with dementia want to do as much as they can for themselves for as long as possible. And the Alzheimer's Association is great about trying to encourage folks to take action early. Um, uh, because of the fact that early on within Alzheimer's and dementia, having conversations about how people would like to move forward with their diagnosis is very helpful to a caregiver. So when we think about people who have been diagnosed, they want to care for themselves as long as they possibly can. And so having that conversation might be important when first diagnosed. As a caregiver, you likely know the person best. You know their likes, their dislikes. You know things that they like to eat and they don't like to eat. You know how private they are or how they're okay, perhaps, with different situations in the household. So think about those things as you care for an individual and make note of that, because when we think of person-centered care, it means that we're thinking of the person and how they would most like to be treated. We'll also try to include people living with dementia in conversations about their support. And as I said earlier, having a conversation with someone to say, okay, well, if this happens, how should we progress? How can we progress? Sometimes that's not always possible, but it is a good place to start. So let's start here with a knowledge check. I want you to think about this. Is this true or false? All people living with dementia need the same amount of support. Well, if you did answer false, you are correct. Each person living with dementia has a different strength or ability. And as a caregiver, you can use what you know about a person to apply it to various situations to provide the right amount of support. Many of you might be caregiving, but you don't know the person very well. Maybe you're stepping in for someone, or maybe you're a brother or a sister who comes in to the picture. So really having conversations with those around individuals is a good place to start as well. So as was mentioned on the earlier slide, each person living with dementia is unique, and Alzheimer's causes more damage to brain cells as the disease progresses. So while something might be working 1 month, it might work very differently for you in your household to care for an individual months later. Okay, so as the disease progresses, you might have to change up your strategies in order to support this individual the best that you can with the right approach. So it makes for the disease makes it hard for an individual to, number one, follow instructions, especially tedious instructions with lots of steps involved. It is also difficult, and it becomes more difficult as the disease progresses, to move from one activity to the next. Okay, so keeping these things in mind as you provide care can be helpful. And then also it can be difficult to remember the next step to do the task. So perhaps they remember, okay, I'm opening a can, I'm going to pour it into the container, and now I've forgotten what I do next. Okay, so maybe that's someplace where we say to ourselves, okay, how can I start to ask where I can help at this point? So we do want to encourage independence as well. So these are biggies. In fact, those of you that have your handouts in front of you, you'll notice that there's some bolded words that are important for us to think about as we encourage independence. Number one, focus on what a person can do instead of what they can't do. So think about all the things that they're able to do at that time, and proceed by supporting them and doing those things if they can. Do tasks with a person instead of just doing everything for the person, okay? And then connect with them instead of correcting them. It gets very difficult on both sides, very frustrating when there's constantly correction going on instead of connection. So as we think about maintaining or maximizing a person's independence, we need to assess and modify. And oftentimes we need to do that quite often. You'll need to adjust your approach as the abilities of the person you're caring for changes. So again, one day things might be going well, and then you all of a sudden start to see that things are very different. So that now it's time for a reassessment. As the disease progresses, break tasks into smaller steps. We're going to do this, and when that gets done, then we move on to the next part of the task, okay? Just know that the person may not be able to finish them all on their own, but that doesn't mean you just take over the task and say, I'm going to do it. You can certainly support them in the areas that they can do. And those things that they're having difficulty with, we assist with initially if we can. So we're going to be talking today, and you heard me mention it earlier, about a person-centered support for activities. And this means that we're going to explore how we can help and care for an individual based on what we know about that individual, their likes, their dislikes. And this care includes perhaps dressing, eating, using the toilet, and bathing. Those are some of the areas that we'll focus on today. However, they may need support at different times of their life in different activities, but today these are the few that we're going to focus on simply because they happen every day and sometimes they can be a challenge for folks. So in the early stage of Alzheimer's, a person usually is pretty independent with activities like dressing, eating, using the toilet, and bathing. But over time, they'll need some support with activities. So you'll need to adjust that support based on the person's needs, their abilities, again, their likes, their dislikes, and so forth. So we're going to listen now to a brief video from a caregiver who would like to explain to you how she is handling caregiving in her household.
So with mom, examples around mealtime and cooking, she was willing to allow for my sister and I to prepare meals. And what we would do is have her maybe break apart celery or chop up some bigger size vegetables if we were doing a soup or something, and still incorporate her in those activities. As again, the condition continued to progress, we then would just manage the full preparation ourselves, but supported her process in terms of the eating.
Okay, so we're going to look very carefully at 4 ways to support personal care activities. Number 1, here you see planning your approach. So doing a little planning on the front end. Number 2, simplifying the process. Perhaps the process doesn't need to be as tedious as it had been when you first began doing these things. Create the right environment for an individual. Make sure it's safe and secure. Is it bright? Is it cold? Is it too warm? Is it noisy? Think about the environment as well. And then also identify any health issues that might be going on with the individual above and beyond the diagnosis that might too be interfering with what's going on, maybe something very new to them that you didn't experience before, that perhaps a conversation with a doctor might need to take place. So let's look at planning your approach first. Okay, we want to think about the person's likes, dislikes, and abilities. Number 1, those are things that'll factor in, because if a person really liked something or disliked something for years, if you factor that in on the front end, it can certainly help things go a little bit more smoothly or seamlessly if you keep those things in mind. With each activity, we do want to treat the individual with dignity and respect. Give them some choices. You don't have to give them 10 choices, maybe 2 choices. But giving the individual respect and dignity to be able to do the things they can do can certainly be beneficial to the whole situation, and it's certainly the right thing to do for individuals. Plan enough time to finish a task so the person doesn't feel rushed. This is true of you as well. As you're a caregiver and you're helping folks out, if you feel rushed to get something done during a time frame and it's not happening the way that you would like it to be done, perhaps the frustration will become part of both parties. Next, we want to think about simplifying the process. Maybe break an activity or a task into smaller steps and focus on one step of the entire task at a time. So as you think about getting dressed, as you think about eating a meal, as you think about prepping a meal, what are some ways that you could break it down simplistically into smaller steps to ultimately get to your end goal? Take out any extra questions or steps that aren't necessary. So if you keep asking an individual, what would you like? And how about this? And how about that? And what are we doing next? It's difficult, right? So as we think about taking out all the additional extra questions, still being very respectful of the individual, it might be easier for you and the individual to communicate if in fact you're clear, concise, and the questions aren't so overwhelming to an individual who's been diagnosed with Alzheimer's or dementia. Give simple instructions and encourage the person to help them feel successful. So an important thing that you might say, if somebody has a choice of 2 items, great choice. And so when they make a choice, you say great choice so that they feel like they did something, they accomplished something. Or thanks for your help. If you are used to having an individual maybe help you cook meals, but this has gotten a little too much for them, maybe just setting the table would be something that could be helpful, and thanks for your help. And if the forks aren't where the fork's supposed to be, we kind of have to let that go as well. Number 3, create the right environment. So keep the area comfortable and free of distractions. So if you're trying to eat and there's a lot of distractions going on, perhaps that might be difficult. Remove any trip hazards so the person can safely walk around. Trip hazards are things like area rugs that are not attached to the floor. Maybe you've got some cords across the floor. Maybe you've got a dog or a pet that's always under your feet. Be careful of those situations because they can provide an opportunity for a fall. The area should allow a person to have privacy as well. So let's say you got an individual that is visiting a sister or a brother who is going to care for them for a couple of days, and they've actually made a space for them in their living room or their dining room area or something. Making sure that they have privacy during that time is incredibly important, and we'll talk about that through the presentation today. Finally, number 4, identify health issues. So if you see that a person is uncomfortable, maybe they have trouble sitting for a long time or sitting for the amount of time that's required for you to get a task done, or standing for a period of time, keep that in mind and remember that a person may not be able to express that to you, so you're looking for signs yourself. You're given some cues. Maybe a person is itchy, they have maybe dry skin, eczema, maybe they're sensitive to the touch, maybe even their clothes just feel super scratchy on them. Keep that in mind too, because already that is something that's bothersome to them, and then maybe you may go to touch them and it's just one extra thing that may be problematic for them. Talk to your doctor or the person's doctor if you notice any changes in their health. So maybe they're not eating or swallowing as well. Maybe their gums are swollen. Maybe they're having problems going to the restroom. These are all things for you to mention to a doctor. Make sure doctors and nurses know the person is living with dementia. Tell them if the person is taking any medications. So as you go, let's say you have to go to aftercare and you're seeing a doctor for the first time, make sure that they know that this person has been diagnosed with Alzheimer's or dementia and what medications they're currently taking. And it's good to remind a doctor every time you really do go to visit with the person who's been diagnosed. So we're going to work a little bit on applying this process. And you see that there's some icons on the screen here. They are icons of things that I've already talked about or discussed with you. Dressing, bathing, eating, using the toilet. These are all things that perhaps people might have some difficulty with. So I'm going to click on some of these. We'll give you a little brief scenario and then maybe some question and answers in reference to how we may have handled things so that they would have gone a little more smoothly. Okay, so first of all, we want to plan our approach. So with dressing, we want to make sure we have enough time so that we're not rushing so much to get through things, and then frustration becomes part of the scenario. Respect the individual's personal style, including their likes and dislikes. So if you have chosen a few outfits for this individual, respect the fact that it's not about you, it's about what they like to wear, what they feel comfortable in, what they most like in terms of selection. See how much help they need. Perhaps they need just your hand to guide their hand into maybe a sleeve, or maybe your hand to guide their leg into a pant hole, a leg hole. Okay, maybe just scooting their shoe a little bit closer and guiding their foot into the shoe. Maybe that's what they need at that particular time. So again, it's knowing the right approach in a particular time in a person's everyday life. Simplify the process. So right away, you might take off any dirty clothes. As they get soiled as soon as possible, remove them from the area, put them in the washing area. Maybe, as I mentioned earlier, offering 2 outfits that they can choose from. Lay out clothes in the order that they need to be put on. Okay, so oftentimes we'll make a stack and it'll be the pants, the shirt, and so forth. And oftentimes a person will look at the first item that's on the pile and put that on first. So as you think about putting things out or laying things out for individuals, there's a progression, right? We put our undergarments on first, and then we put other things on, and we might put a sweater on top of that. So again, if you can give some verbal or some cues just by the way that you lay out clothing, that can be important. Use gentle physical prompts to help the person dress themselves. And I mentioned that a few minutes ago, helping to guide their arm in the sleeve, the leg in the pant hole, the shoes and socks on, if that's what they need. Creating the right environment. Make sure that they can dress in a safe area that makes them feel comfortable. So close curtains, maybe put the door shut a little bit as you're in there with them. Maybe this person has never really dressed with another individual in the room with them, or even used the toilet or bathed with another person in the room. So this might be uncomfortable for them, and we want to make them feel as comfortable as possible. So either cover them up while they're dressing, give them some privacy, maybe a room screen that they can be behind, something that then help them feel that they have privacy and comfort. So let's listen to another caregiver as she talks a little bit about her mother and caring for her.
My approach to getting my mother dressed as her needs changed and through the process was to keep her involved in what it is that she would put on. My mother was always somewhat of a vain person, and she liked really looking nice. So I would try to buy her outfits that she really liked, that really appealed to her. I would try to buy colors that I knew that she liked. When it was time to get dressed, I would present several outfits to her and let her select what it is that she wanted to wear that day. And just to keep her motivated and as a part of the process, to keep her interacting with me. She really liked looking nice. I liked doing things like keeping her hair done and whatever. And she seemed to appreciate that part of my effort to involve her in the process.
And one thing I forgot to mention too, remember if a person is dressing in a bathroom or something, remember those tiles can get slick, especially if it's been after a shower or a bath. So just again, remember that there's a fall hazard there too that you might want to think about when you think about the environment. All right, so we're going to dig into this a little bit more. We're going to see what kind of strategies we can put in place. So here's the scenario. Lucy's partner, Helen, is living with dementia. Helen usually sleeps late and for the last several months has been able to dress herself without any help. One day, Lucy notices Helen is not wearing underwear or a bra under her clothes. The next morning, Lucy decides to just dress Helen herself so they can get out the door a little more quickly. Now let's dig into this. How could Lucy have changed her approach to help Helen remain independent with dressing by providing just the right amount of support? If we read the sentences here, and I'll read them out loud, choose one or two. You can say it to me here in the room, you can put it in the chat box, but for number one, each night Lucy picks out an outfit with Helen and lays out the clothes for the next day to allow for more time in the morning. Or number two, instead of letting Helen sleep in, Lucy wakes her up early, an hour early, so that she doesn't have to rush getting Helen dressed in the morning. So if you selected one, you are correct. You picked the best answer here. Instead of throwing Helen off of her sleep schedule and maybe even disorienting her, maybe doing some prep as we think about putting into practice, prepping things on the front end, it is probably a better choice for you in this scenario. Okay, so as we think about simplifying the process, either Lucy dresses Helen each morning, then allowing her to dress herself, or number two, is it a better choice for Lucy hands Helen one piece of clothing at a time so Helen can dress herself? What do you think? Which would be the best approach? Okay, yeah, handing her a piece of clothing, especially in order of when it needs to be put on the body, is very helpful to both. So do you see how folks are working together here? You're working with instead of just doing it for the individual, okay? Now, creating the right environment. Lucy makes sure to close the bedroom curtains when Helen is getting dressed so she has privacy. Is that a good one? Or would it be better for Lucy to turn on the TV and watch the news as she dresses Helen? Which would be a better choice? Number one is a great choice because, again, we want to think about the individual's privacy. And if you turn on the television, that's quite a distraction. So while you might feel like it's a good way to kind of distract you, it also can be a distraction to others. So we're going to choose one. Okay, so that was dressing. How about we look at bathing? We might not have a time to go through all of these, but I want to kind of set the stage for you as you think about caring for others, okay? So in terms of bathing, important, again, for us to plan our approach. First and foremost, does the person prefer taking a bath or a shower? A shower, a person needs to stand up as well. So how comfortable would that be for an individual? And do you have the tools to support that for the individual? Consider their usual routine, okay? And then allow enough time for bathing because bathing may take some time, all right? So let me go through this one with you. So number two, simplifying the process. Use words and actions to show the person how to wash their body. So if I'm standing in front of you right now and I want to wash my neck, I would motion to the individual. So they're seeing your face, they're kind of listening to your words, and they also see that you're doing the same thing, okay? Encourage independence, but provide help when needed. So let's say holding the bar of soap, it just keeps falling to the ground because I know that I drop the soap often, right? So maybe you want to rub the soap on a washcloth for the individual and then hand the washcloth to them simply because it's a little easier to hold on to that and to clean yourself up. Focus on cleaning one part of the body at the time. So perhaps you're talking about, again, the neck. Maybe you're talking about the face. Instead of saying, wash up in there, oftentimes you might need to give some more direction, and maybe it is breaking the whole operation down into smaller pieces, simplifying the process, which is very beneficial to an individual. And remember, this isn't an area to rush, so give yourself enough time to be able to move through this whole operation or task. Then create the right environment. Provide a quiet, relaxing, and warm space. How many of you have ever been in a freezing cold bathroom when it's time to take a shower and you're just hoping that it gets warmer in there quicker? Respect the person's privacy. Remember that this may be, it may have been a long time before this individual had anyone in the bathroom with them as they take a shower. So undressing or disrobing in front of someone else can be difficult. Help them to feel safe, and then again, make sure that room temperature isn't too cold for them. And then number 4 is to, again, identify any kind of health issues. Consider the person's physical and medical issues. Some may affect the bathing process. So think about everything that's going on with this individual and what you need to take into consideration as this person bathes or showers. Find out if the person has any pain or trouble moving around as they are in the tub or the shower. So we're going to listen to this gentleman. He's such a sweet man as he talks about caring for his wife.
I always knew that Kathleen doesn't like a cold bathroom. So when she began to lose her ability to sequence a complete task like taking a shower, I stepped in and got the bathroom warm for her, started the shower at the risk of wasting a little bit of hot water, such that I could tell her, sweetheart, I got the bathroom nice and warm, all steamy and warm for you. Come on in. And of course, that led to lots of laughs when she walked in and saw my glasses all steamed up. She thought that was just the funniest thing, but she was grateful that I had cared enough to get the bathroom warm for her. And then initially, of course, she didn't want any help, in the shower. That's a very personal thing, and I respected that, but nevertheless, I stayed in the bathroom, just making sure that she was okay. And then gradually, I said, could I help you with the shampoo there? And I assured her that I knew all about taking care of hair, but she allowed me to help with the shampoo to make sure that we got it all out of her hair. And then, of course, the luxury of nice warm towels waiting for her as she stepped out of the shower. She really appreciated that. And my goodness, what a great, somewhat intimate connection that was, to be able to help my wife in the shower. It was, I'm sorry that I had to do it, but I'm glad that I had the opportunity to do it.
So let's look at kind of the question and answer that we did earlier. We'll give you a scenario here, and we'll put all these pieces back together and into practice. So Barbara is living with frontotemporal dementia, and her husband, Joe, recently made the difficult decision to move her into a nursing home. She's in a wheelchair, has trouble communicating, and has always been very modest. When she lived at home, Joe would help her shower in the morning when she was more alert and relaxed. She always preferred to wash her face and arms with a washcloth. While visiting Barbara, Joe learned that she got upset with the staff and resisted taking a bath the night before and would not let them wash her. So let's see what maybe we can do here. As we think about planning an approach, which would you think is a better approach here, one or two? Number one, Joe suggests that the staff offer Barbara a shower in the morning, as this was her routine at home and when she was most relaxed and alert. Or number two, Joe agrees that the staff should keep trying to give Barbara a bath, as she will eventually have to agree. Which do you suggest, one or two? One. Okay. Hopefully those of you at home were thinking of one as a good suggestion here. And again, throughout the stages of dementia, perhaps this is just a difficult task all the way around, but these are things to try. These are things to, again, give people respect and dignity with the information you know at the time. Okay, in terms of simplifying the process, number one, Joe recommends that the staff quickly wash Barbara to shorten the amount of time she is upset. Or would it be a better idea for Joe to show the staff how he would put soap on the washcloth and then give Barbara some verbal cues as to how to wash her face and arms? Which would you select here? Either one or two? Yeah, two shows the staff, showing the staff, and also shows the staff that this was working. Let's continue this. Let's have this conversation. So having a conversation with those that are providing care is very important in order to respect Barbara. Now think about creating the right environment. So number one, Joe suggests that the staff quickly wheel Barbara from her room to the shower room after they get her ready for a shower. Or would it be a better idea for Joe to ask the staff if they could get Barbara ready for her shower in the shower room where it's quiet and warm instead of her bedroom and then taking her down the hall? Which would you think would be a better opportunity for Barbara? Yeah, so if you can get her ready closer to the shower stall, instead of disrobing her and then wheeling her down the hall where it's cold and she might feel exposed. So asking the staff to get her ready for a shower near the shower room is a good idea. Okay, and then finally, identifying health issues. So number one, maybe Joe asked the nurse if Barbara has had any changes in medication or has any new health concerns. Or should Joe just assume the staff will let him know if there are any changes in Barbara's health when they feel like it's warranted? Yes, one is a good choice. Joe asking the nurse if there has been any changes in medication or new health concerns is a really great idea, simply because a nurse can be very busy and perhaps forget to say something to Joe. And so if Joe takes the initiative to ask about Barbara's health and medication ahead of time, he's certainly showing compassion for Barbara and wanting to make a note of it for himself when in fact he needs to provide care as well. We'll finish up with one more because we've got some more after this, so I want to make sure that I'm considerate of time. Let's talk about eating, because this can be difficult for folks as well. Sometimes a person will forget that they've eaten. Sometimes the person will say, I'm not interested in eating. And so let's kind of work through this to see how we can plan our approach and work through the 4 different areas that we are focusing on today. Number one, for eating, plan your approach. Think about what foods the person likes and how they like them cooked. So I know I like spinach raw, but I do not like spinach cooked. So if that, if I can tell you right now, and this person perhaps was near and dear to you for many years, you may already know that. So offering them the foods that they like, how they like them cook is a good way to start a meal. Be flexible with meal times. If the person is upset and refuses to eat, then wait to offer them food when they're ready. Because it can be difficult and frustrating for you as well as them. So wait till that person is ready. Look for ways to include the person in making the meal, setting the table, or filling their own plate. This is where you might even say that I know I've got glass dishes at home, ceramic dishes at home, I have plastic dishes at home. So if something falls on the floor or it gets tipped over, it's less of a concern to everybody, less alarming to everyone. So even thinking about that as well. Think about simplifying the process as you are continuing to eat together. Offer only a couple of food choices and give the person time to choose what they'd like to eat. Encourage them with simple instructions. And I know that oftentimes a person may even forget how to pick up food, put it on the utensil, and get it to their mouth. So you may give them very specific instructions, how to scoop up their food. And if you're seeing that they're having trouble with one type of utensil, perhaps you can give them a spoon. I know there are times I can't pick noodles up, so I just use a spoon to do it, right? So that you might have some special forks and knives and spoons that would be easier for them to use, but sitting with them and having a little bit of eye contact with them and helping them through the meal can be important too. As you create the right environment for eating, make sure it's quiet and comfortable. Limit the distractions. I know lots of families like to have the television going when they're eating. Oftentimes turning off the television so there's less distraction in the room can allow both of you to focus on what's happening and eating. If you do play music, make sure it's soft and relaxing. Keep the volume low because, again, music can be a distraction to individuals. Make sure there's good lighting in the dining area so the food is easy for them to see. They know what they're eating. There aren't a lot of shadows on the table. And they can, in fact, understand what it is that they are eating. And then identify any health issues. Watch for changes in an individual's ability to eat, chew, swallow. If their dentures are worn, or maybe they fit incorrectly, maybe that's a problem for them. Watch for sores in their mouth, swollen gums, loose teeth, and then reach out to the doctor to say that this person doesn't seem to be eating and drinking correctly. Perhaps there's something going on that needs to be addressed. So we're going to listen to a caregiver as she talks about feeding or eating with her mom at home.
We realized that she was no longer maybe able to chew things like meats, chicken. And so we started, not by, I guess, a conscious decision, but just because of mom showing us what she could and could not do with regards to eating, doing more of a vegetarian diet for her, and definitely things where we would use softer foods as a disease progressed. So we were able to incorporate different flavors and meals that were still very much a part of the cuisine that she was used to, and the sazon flavors that were familiar to her, with things like eggplant, which was something that maybe she never necessarily had as a child or as an adult. But we were able to season it to her liking, and that's something that we kept kind of on a regular part of our meal planning, to make sure that she still had the nutrients that she needed, but also keeping the flavors that she knew and liked.
So let's put all these pieces together. Lee is living with Parkinson's disease dementia. He lives with his daughter, Naomi, and her 2 kids. He's usually independent in preparing and eating his favorite breakfast, which is toast with butter. The house is usually very noisy in the morning as the kids prepare to go to school. Naomi notices that Lee is experiencing more tremors with his hands. He's also having more difficulty using the knife to butter his toast. He keeps dropping the toast when trying to feed himself. He starts staying in his bedroom instead of having breakfast with the family. One morning, Naomi sits Lee at the table with the kids and starts feeding him his breakfast. So we'll go through this practice of our 4 little steps here, planning our approach. Which do you think is a better approach here? Naomi asks Lee if she can help by buttering the toast for him, or Naomi keeps reminding Lee it's morning and it's time to eat breakfast. Which would you think would be a better choice for him? In the room here, the consensus was Naomi asked Lee if she can help by buttering the toast for him. So this is that first step of figuring out if you can provide help instead of just grabbing the whole task away from them. Okay, as we think about simplifying the approach, should Naomi either put jelly on the toast, hoping that it will make Lee want to eat it? Or should Naomi cut Lee's toast into smaller pieces so it's easier for him to pick up the food and feed himself? Which of the 2 choices is best? We get a general consensus in the room that number 2 is a better choice. Again, in the very beginning, it said that Lee liked toast and butter. There was no real mention of jelly. So even changing things up could make things a little bit more difficult there. But maybe cutting his pieces of toast into smaller pieces will help him get his fingers around them to put them in, pick them up and put them in his mouth a little more easily. Creating the right environment. So Naomi offers Lee breakfast after the kids go to school when there is less noise in the house. Or should Naomi have Lee eat breakfast in his bedroom while the kids are in the kitchen? Which is a better choice here? Yeah, as the commotion of the kitchen kind of goes away, now Lee can sit down and have breakfast without a lot of noise and confusion. We don't want to isolate people. So having a person eat by themselves in their bedroom is a difficult thing for both. So just making some time after there's less noise, the children jump on the bus, and now it's time to focus on Lee and helping him eat his breakfast. There we go. Okay. When we think about health issues, should Naomi call Lee's doctor to let him know about an increase in the hand tremors that she noticed as a change, and also a change in Lee's eating habits? Or should she say to herself, oh, he looks fine, so I don't need to worry about any health issues? What do you think is the best choice here? 1, right? And in a busy life with children in the household, I know that sometimes you get busy with things, but it is important to be really observant about what's going on, because it can make life easier for you, and caring for a loved one is difficult already, so making sure they're in their best health. And if something is new that they're experiencing, it's important to talk to their doctor about it. Okay, let's talk about taking part in meaningful activities. So when looking for ways to help a person living with dementia maintain their independence, it's important to consider how to help them stay engaged in their own daily life. This includes finding activities that they enjoy and find meaningful and rewarding. So we're going to take a look at some of those things that we might consider here. So as we mentioned earlier, it's important to pay attention to their likes and dislikes. So take note when the person seems happy or anxious or bored or frustrated or irritated or really happy and calm about something. Take note of all those things. For example, when some people are watching sports while, they might get noisy, they might get boisterous and cheering and so forth. For some, that might be fine, but for others, this might be a difficult thing for them to do. So think about how perhaps this individual is changing and make note of their likes and dislikes. Help start an activity with them. For example, maybe folding a towel. Maybe the person is with you in the room and you say, hey, how about we fold the towels together? So perhaps you folding the first towel or drying the first dish might be a helpful prompt for that individual. And then talk through the steps as you do them. I'm folding corner to corner. I like to fold corner to corner, or whatever you like to say. Or to people, you have to say that perhaps however they fold it is good enough, right? We're getting things folded and it's good enough. So thinking about things that folks can still do and how can I provide the right support or the right amount of support. So when we think of focusing on doing activities rather than the result, it's not as important if something is done right. Does it really matter, as I said earlier, if the towels are folded absolutely the way you like them? Not really. What matters is the person feels useful and you are able to spend some time together. Remember to break activities into easy to follow steps. Keep it simple. Be sure to focus on one task at a time. Too many directions at once can be overwhelming. And if you notice the person is having trouble with the more difficult parts of a task, certainly offer to help. Remember to talk to the person. Describe what you are doing while you are cleaning the house, folding the laundry, cooking the dinner. Even if they can't respond, they will benefit from this back and forth communication or just communication in general. If something isn't working, it may just be the wrong time of day, or the activity could be too hard for the person at the moment. So it's important to know that some things might work one day and they might not work the next day, or they might work 1 month and they don't work well the next month. And maybe even adjusting how you do things to help the situation on both sides is important. So as we think about the right amount of support, it's important for us to find a balance. Too much or too little support can have unintended consequences. For example, providing too little support can make a person feel incredibly frustrated or make them want to give up completely on a task. And then too much support may make a person feel as though their thoughts, their emotions, and their abilities aren't being taken into effect, or they're not important to an individual. So let them know that you are there for support and you certainly want their participation as much as they can give it. Tips to provide just enough support. Consider what you know about the person. It's essential to learn as much as you can about the person you care for. Find out, again, their likes, their dislikes, those things that are strengths for them, their abilities, and again, these may change over time. Ask about their preferences. Perhaps an individual is having trouble getting to the restroom quick enough. So maybe remembering that the buckle and the belt and the button and the zipper on the top of their pants may be hindering that. So having a conversation about how about we try to find some pants that will work better, easily, more comfy as you're sitting down, and perhaps a conversation in that direction can be helpful. Remember to change how you do activities that allow them to have success. The person might need help with a simple task, or they may need help simplifying the steps for a larger task. Start out small. Begin with a small amount of support and see how things go. Don't be afraid to try out something new as long as it's supportive. If it doesn't work, you try something else. Organize the environment, things like schedules. Match the person's best times of day with the most important activities. As was mentioned in the earlier video or the scenario where the gentleman was saying, my wife Barbara is more alert in the morning, so this is the time I choose to do this task. Be looking at your everyday schedule for yourself as well as the individual you're caring for, and try to make changes as needed. So you all have in your hands, and those of you at home, I'm hoping you received the activity. It is this take-home activity or do-at-home activity. And it kind of is very similar to the scenario that we've used a couple of times during the course of our day today. It is providing the right amount of support. And you can see that the handout that I'm speaking of is appearing on your screen right now. I'm actually going to scroll down through it so that we can look at it together to see what the objective here is for you. But we thought maybe you could plug in your own situations to see if you can figure out exactly what you might provide in the scenario that's provided here in the body of the handout. But then as we proceed through the handout, there may be some ways that you can think about what you might do in your own life as you care for individuals who may be diagnosed with Alzheimer's and dementia. So at the top here, you'll read Clara's story. You'll notice how Clara's daughter, Emily, helps her stay independent by offering just the right amount of support. And then as you go through the document, it talks about some of those key things to focus on. What can the person do instead of can't do? How can I help with a person to finish a task rather than just do it for the person? And then how can I connect with the person instead of correct with this individual? Again, things change over time. To the point where some people will be unable to do these tasks, but certainly as the disease progresses, you'll have to kind of figure out where you are in that progression. Now, at the very bottom here, you'll see that this is a place for you to fill in. Think about the person you are caring for, and how can you encourage their independence? How can you adjust your approach by providing just the right amount of support? So they'll give you some activities in here that you can answer some questions. Again, there's those tips for providing the right amount of support in terms of the person, the environment, starting out small, all of those things that we've mentioned in the past here today. I'm going to be mentioning this at the end of the presentation today, but notice the contact information from the Alzheimer's Association is listed on the bottom of this handout, and it is in your PowerPoint handouts today. Know that they have a 24/7 kind of a helpline that you can call at any time. A master's level clinician will answer that call for you and point you in the right direction or give you some information about how they can best help you. So keep that in mind as well. Finally, our presentation is going to focus on balancing safety and independence, because there are things that we may have done throughout our lives that are going to change, and we want to make sure that everyone in their environment is safe. So let's do a knowledge check again. You only need to worry about safety in the late stage of the disease. Is this true or false? False. And honestly, we should be worried about safety all the time for all of us. Perhaps there are things that we take into consideration with an individual as the disease progresses, but safety should be top of mind for our living situations, okay? So again, the answer there was false, okay? It's never too early to create a plan for a person's safety. This can reduce risk and prevent injuries, and it can also make everyone feel a little more relaxed. So let's look at some of these areas where we might see some safety issues. As we balance safety and independent, we know that it's very important for people to stay as independent as they possibly can for as long as they can. So as the disease progresses, it can be harder for you to balance safety with independence, but we want to make sure that you're putting some actions in place before an accident happens, okay? So as we think about Alzheimer's, it may have an effect on our judgment. Forgetting how to safely use appliances like a stove can be problematic. Whereas instead of holding the handle of a kettle, we saw a kettle in a recent picture here, maybe I pick up the kettle this way, where I've got my hands around the very hot part of the kettle, just because our judgment can be affected. So let's look at some examples together. Also, our behavior. Behavior is easily, it can easily become anxious, confused, or afraid. They might not even trust the people that they've trusted for many, many years. They might not recognize you as an individual that's been caring for them for a long period of time. And they may feel that you're harmful to them. So they may, in fact, try to protect themselves. So let's think about that one as well. Physical ability. Remember that, folks, their physical ability can change. They might have trouble with balance, and they sure can be more at risk for falls. In Indiana, we've got lots of, I think it's 1 in 4 visits to the emergency room is usually a fall by an older individual. So falls are already problematic as people age. So having dementia can also be a balance issue for folks as well, or provide a balance issue for folks as well. And then as we sense things, as we hear things, our vision often changes, our hearing changes, our sensitivity to temperatures might change. So we might have trouble with depth perception. You might say, the rug has a pattern in it that is really kind of throwing me off. So perhaps that's something to attend to, right? So judging where objects are can be difficult for a person who's starting to have some depth perception issues. So tips to help a person stay independent and safe. What about garages? What's in your garage? What about workrooms at home? What about basements? Your outside areas? Make sure that the tools that are in those areas are put away and contained. Watch out for chemicals. Are they easily accessible, or is a bottle very recognizable, or maybe it could be misconstrued as something different? So having dangerous items safely secured is very important. You can look at the Alzheimer's Association's home safety checklist, which is online at alz.org/checklist for more tips on how to make sure your home is safe. This is really invaluable to anyone. You can have a person who's been diagnosed with dementia. You can also have children in the household that may touch or identify something incorrectly or use something that they shouldn't be using. So again, this safety feature is important to everyone. Someday the person living with dementia will no longer be able to drive, and this is huge in a person's sense of independence. So it's very important to discuss how you're going to retire from driving with this individual. How are you going to handle it before it becomes an issue? Having this conversation is important. ALZ2 has online, and you could even call the 800 number, ALZ/driving, where you can learn how to make that plan with an individual and kind of walk you through some planning as you think about this, because this is truly difficult for folks as they think about their independence. We also want to think about firearm safety. So if you have firearms in the house, they can be dangerous for everyone. When someone living in the home has dementia, consider removing those guns or weapons from the home or storing them in a locked cabinet. Remember to invite trusted relatives, hunting buddies, or other authority figures to take part in discussions about firearms with the individual who's been diagnosed with Alzheimer's or dementia. Once again, the Alzheimer's Association has some safety plans for you that you can either download online, alz.org/safety, to learn more about this, or if you're not a person that likes to search online, the 800 help number is available 24/7. What about getting around safely inside your home, outside of your home? So look for places where people might trip and fall. Somebody recently said that they very rarely roll up the hose during the summer because they keep having to drag it out. Well, that hose goes right across the sidewalk. And for somebody who is conscious of it and watching it and stepping over things is easy for them. Perhaps the grass is green and the hose is green, and I can't tell the difference between it. So my judgment, my depth perception is off. I can trip over that hose. So thinking about your interior of your home and the exterior, where a person might be tooling around or walking around, how safe is it and how important is it for you to avoid trip and fall hazards? Make sure the person takes a fully charged phone or GPS with them when they do go for a walk. And again, the stages of dementia are broad. So early stage, middle stage, perhaps this person is still taking a walk by themselves. Okay, so make sure they have the tools that they need. I think this one is really important, this third bullet point. Tell your neighbors that there is a person living in your home with dementia. And if they're friendly with you and you want to disclose who that is, they can help you if this person is looking lost or confused while they're on the sidewalk out front. So again, letting people know in your neighborhood that you communicate with, that there is a person living with dementia, and if in fact you need to be called, provide that number for them. You can also enroll the person in a medical identification program. So if they have that identification on them and they do get lost, they can get you, they can get this person back to where they need to be. We also want you to think about managing your expectations. So as you think about things that you can kind of say to yourself, you see them in the bubbles here. Ask yourself what really matters in the scheme of things. I hope you ask yourself that you can spend more time with this person that you love and care for, that if in fact the towels aren't folded the way that you like to fold them, that you can let it go. Again, is this person safe, cared for, fed? Am I doing what I can for this individual? If it's not done right, so what? I'm going to go with the flow here. So give yourself a break as well as you think about caring for an individual, and try not to focus on those things that may once have been very important, when in fact they really, in the scheme of things, probably aren't the most important thing of the day. And maybe if you can let them go, it will help your stress level, frustration, and your overall health and wellness as well. So this slide is from the Alzheimer's Association, where we share all the resources that I've talked to you about earlier. The 24/7 helpline is listed here. It is an 800 number, 800-272-3900. It is available 24/7. Master's level clinicians answer the phone. I have heard from many people who have used the helpline who just felt like they were lost until they were able to speak with somebody in terms of what kind of help they needed. You also have local resources. So we have local chapters here in Lake County. support groups that are here in Lake County. So if you're feeling like you need support, you can find a list of support groups in your area where you can meet and talk to others who have the same concerns as you do and need to speak with someone in order to provide support. Alzheimer's Association and AARP also have a community resource finder that you can find online if you're looking for doctors, if you're looking for transportation, if you're looking for care, whatever type of care it is. There's lots of opportunities for you to find information there. The bottom of the screen, I've already mentioned care, safety, and driving. Those are biggies. So alz.org has lots of information online for you to connect with and read how it is that you can approach some of the things that you're dealing with as you think about the individual you're caring for. And finally, in the other box off to the side, on the right side, you can see that there are educational programs like the one you're here for us today. We want to thank Cure for offering this online for those of you that wanted to be at home, and in person for those of you that wanted to come here today. Thank you, everyone, for your time and your participation today. We hope to see you again soon.